Greetings. I'm Mary Harris Reese from the African American Community Partnership Group, AACPG. We are a community-based group with the mission of addressing disparities among the underserved African American community. We do this through education, advocacy, and self-care. Today, we are in collaboration with the nurses of Nu Phi chapter of Chi Eta Phi Sorority Incorporated in presenting this Kidney Sunday national program. This program focuses on kidney health and is an initiative of the National Institute of Diabetes, Digestive and Kidney Diseases. Normally, this program is presented at various churches throughout the community during the month of March, as March is Kidney Awareness Month. But due to COVID, we are presenting a virtual program this year. Kidney Sunday is a great opportunity to raise awareness with the faith community about the risks for kidney disease and the importance of getting tested. The African American, Hispanic, and American Indian population are at high risk for developing kidney failure. The high risk of kidney disease among these populations is due in part to high rates of diabetes and high blood pressure in these populations. I will introduce the panel to you, but before introducing the entire panel, I will now go to the president of the Chi Eta Phi Nurses Sorority Nu Phi chapter, Soror Brenda Woods.
Thank you, Soror Mary. As she said, my name is Brenda Wood. I am the president of Nu Phi chapter of Chi Eta Phi Sorority Incorporated. Chi Eta Phi Sorority Incorporated has been around since 1932. That is 88 years to be exact. This was started by 12 charter members, all African American, who wanted to be part of a nursing organization and was not allowed due to their ethnicity, so they created their own. Our local chapter, Nu Phi chapter, has been around since 1995. So we have been around for 25 years. The mission of Chi Eta Phi is to elevate the plane of nursing and to promote disease prevention and to also service for humanity is our motto. And if you are interested in joining Chi Eta Phi, we are always looking for nurses. We are a diverse group at this time. You can Google Chi Eta Phi sorority. Our national website will come up. You can also Google Nu Phi chapter of Waukegan, and you will find our local chapter website. If you are interested in partnering or collaborating with us, we would be more than happy. We are always interested in helping others sponsor or co-sponsor educational events and events for disease prevention and promotion. Thank you.
Thank you, Soror Brenda. Okay, to give you an overview of what we'll be covering today, we will be going over testing and treatment, risk factors, protecting the kidneys, and looking out for one another. So to start the introduction of the panelists, I am Mary Harris Reese, MA, BS, RN. I am going to be your moderator today. I am a member of the African American Community Partnership Group. I am a registered nurse with 20 years of clinical nursing experience and 20 years of administrative experience as a quality improvement coordinator manager, and also previously 5 years of academia experience as adjunct faculty for the College of Lake County, teaching the clinical and theory for the Certified Nursing Assistant program. I am a member of Chi Eta Phi Nurses Sorority, Nu Phi chapter, a member of the Delta Sigma Theta Sorority, Waukegan Alumni chapter, and co-founder member of the North Shore chapter of the National Black Nurses Association. So just to start off, a brief overview. Today, we just want to raise the awareness of 2 of the leading causes of kidney diseases. Before I get too far into this, I do want to encourage you to please like our page, AACPG. Please share with your your Facebook friends, your other social media platforms also. So looking at the two leading causes of kidney disease, they are diabetes and high blood pressure. And usually there's no signs that the kidneys are being damaged until kidney failure is imminent. And by then, it's usually too late to do anything other than begin dialysis or have a kidney transplant in order to maintain health. So testing is the only way to know if you have kidney disease. So our theme is to make the kidney connection and get tested. We will now go to Sonia Cooks, and she will cover risk factors.
Thank you, Sorrel Mary. You're absolutely right. Most people don't realize that they have kidney failure until it's a little bit too late. I think everybody knows where their kidneys are located, but don't really understand all the pathophysiology and the things that the kidneys are responsible for. So your kidneys are primarily responsible for waste metabolism. They get rid of all the byproducts that your body uses every day. In addition to that, they help regulate your blood pressure, they help produce red blood cells, and they also help with bone health. So you can see how important it is to have a functioning kidney. So when we talk about risk factors in the African American community, diabetes and hypertension are the number 2 causes. Hypertension, then diabetes. Both of those over time can cause destruction of blood vessels, scarring of blood vessels, which ultimately lead to decreased blood flow to the kidneys. In fact, African Americans, we only make up 13% of the population, but we make up 50% of renal failure. When it comes to dialysis, which is, when your kidneys are no longer able to function and excrete waste products, you have to go on a machine that kind of helps pull out that waste product. We actually make 35% of the population. And again, we only represent 13% of the population. So that really speaks to the importance of understanding the risk factors and making sure that you manage those risk factors. So, you, in partnership with your healthcare provider, should be managing your blood pressure, and you should be managing your blood sugars. Those along, it's hard to give you a value in terms of what your blood sugar and your blood pressure should be, because that is all individualized. But make sure that if you have these risk factors, you do things to control or maintain or manage, I should say, your blood pressure and your diabetes. And if you don't have them, then make sure that you reduce these risk factors by making sure that you monitor your diet, you exercise, and you have a healthy lifestyle to decrease the risk of developing these potential risk factors.
Thank you so much for those risk factors, Sonia. Let me just give you all a brief bio of Sonia. She has been a nurse for over 20 years, working in various clinical practice environments. She has spent the past 11 years working as full-time nursing faculty at Gateway Technical College as a nurse educator. Her role primarily consists of working with the 4th semester senior nursing students. In addition, Sonia is a human patient simulation facilitator. In this role, she guides, instructs, and supports students towards achieving concrete learning objectives. Using this platform for clinical instruction has become a valuable source, as students have been limited in obtaining direct patient contact. So thank you again so much for that, Sonia. We will now go to Sora Brenda, and she will be covering testing and treatment.
Thank you, Sora Mary.
Let me give Brenda's brief bio. Brenda is a graduate of CLC and Purdue University. She has been a nurse for 7 years and has advanced quickly, beginning as a telemetry nurse, then assistant manager for telemetry and medical surgical, on to nurse manager for medical surgical, and then to case management director.
Thank you. Focusing back on our kidneys. So as both sources have said, kidney disease is something that you usually don't have any symptoms until the kidneys are damaged. Diabetes and high blood pressure, of course, are the contributing factors. So what you want to do is you want to get tested every year, especially if you have diabetes and you have high blood pressure. It's very, very important. The test that the physician will do, one will be a urine test, the other will be a blood test. The urine test is to check for albumin. Albumin is a protein that can pass into the urine when the kidneys are damaged. The blood test is for the GFR, and the GFR stands for glomerular filtration rate. You want to make sure that your rate is 60% or higher. That will be considered normal. If it's less, you may have kidney disease. So you might want to make sure that you are talking with your health provider if you do see that number. If you have a GFR of 15 or less, you're basically in kidney failure, and your provider will work with you to make sure that the proper treatment is necessary to happen. With regards to the urine test for albumin, definitely protein in your blood, again, as I said, is not good. And what that means is that there is an unhealthy kidney, and it's allowing protein to pass into the urine. I do want to go back a little bit to the blood test. There's one other blood test that is done, and that's the creatinine. Creatinine is probably the most important with regards to the blood test, because you want to make sure that your creatinine is not greater than 1. However, if you are someone who works out, a creatinine 2, if you're a muscle builder, is not extremely alarming. But make sure that you stay in touch with your physician regarding your creatinine level, your GFR, and also your urine albumin level. Sora Mary, are we moving forward to managing kidney disease?
We'll take a quick station identification break at this time in case anyone is just joining us. We are presenting to you kidney disease. We are the Chi Eta Phi Nurses Sorority Nu Phi chapter, and we are working in collaboration on this presentation with the African American Community Partnership Group. So please like our page, please share, and please post on your social media platforms. So yes, Sora Brenda, you can go ahead and proceed with.
Okay, thank you, Sora Mary. And for those of you who are just tuning in, I'm Brenda Wood. I'm one of the members of Nu Phi chapter of Chi Eta Phi Sorority Incorporated. I am actually the president. I just spoke about the testing for kidney disease, a blood test, a urine test. The blood test, you would be looking at the glomerular filtration rate, as well as the creatinine level. Your GFR, you want it to be 60% or less. And your creatinine, you want it to be 1 or less. And moving on to the ways to manage kidney disease. There are 10 ways that you can manage. Of course, 1, blood pressure, since that's a contributing factor, control your blood pressure. 2, make sure your blood glucose is within a range, normal range, if you are a diabetic. Make sure you work with your healthcare team to monitor your kidney health. Take your medications as prescribed. Work with a dietitian to develop a meal plan. You would be looking at a low fat, low cholesterol, a low carb type of meal plan. Make sure your physical activity is part of your routine, and that can be something as simple as walking every day. You don't have to try and be a track star. Start out slow and do what you can. Make sure that you aim for a healthy weight. Typically now, the focus is BMI, and if you have a BMI of 30, you're considered to be obese. A BMI of 25 is considered ideal. You also want to make sure that you get enough sleep, and that if you are a smoker, that you stop smoking. You also want to find healthy ways to cope with stress as well as depression. But make sure focus is blood pressure and diabetes management.
Thank you so much, Brenda, for those tips on managing your kidney disease. We'll move on now and cover protecting the kidneys. This will be presented by Dr. Tracy Washington Baldwin, DMP, MSN, BSN, RN, and she is Vice President of the New Phi chapter. Tracy is a geriatric registered nurse with over 25 years of experience in clinical nursing. She has been a geriatric nurse leader for 8 years. And outside of work and providing community service, Tracy enjoys biking with friends and spending time with her family. So, Tracy.
Hi, Soror Mary, thank you. So I'm going to talk about protecting the kidneys. So you heard a lot of great things from my sorors about how to protect your kidneys and kidney health. So managing your diabetes, high blood pressure, or heart disease is essential for kidney health. By following your healthcare provider's advice, whether that means taking medication, following a specific diet, or being more physically active, you help reduce stress on your heart and blood vessels, which can help protect your kidneys. But even if you follow the advice, it is important to have your kidneys checked for kidney disease. 5 small changes in your everyday life can lead to life-saving differences down the road. These 5 changes to your lifestyle and nutrition will reduce your risk of disease by protecting your kidneys. So 1, blood pressure. It plays a big part in kidney function. As Soror Sonia said earlier, there is no specific number. Everybody is individualized, but keeping your blood pressure at a healthy level around 120/80 will help reduce damage to the kidneys. Smoking and drinking should be avoided because they wreak havoc on your kidneys. For example, the American Journal of Epidemiology found that smoking and consumption of 4 or more servings of alcohol per day are associated with chronic kidney disease. Third, consider supplements that provide calcium and vitamin D if you feel you do not get enough on a daily basis. Always consult with your healthcare provider before taking them. 4, using pain medication and steroids. Limit using pain medication and steroids and only use them when you feel they are absolutely necessary. For example, the Medical Journal of Pharmaceuticals found that non-steroidal anti-inflammatory drugs such as aspirin and ibuprofen pose a significant risk of renal failure for significant periods of time, and as a whole may be under-recognized. Number 5, get active with more active exercise. It will strengthen your entire body and give you more energy. It will help you keep ideal body weight and reduce your risk of obesity, diabetes, and hypertension that can cause damage to the kidneys over time. So let's talk about how you can be more physically active. You do not have to be an athlete to benefit from regular physical activity. Even modest amounts of physical activity can improve your health. Start with small, specific goals such as walking 10 minutes a day, 3 days a week, and build up slowly from there. Try these activities to add more movement to your daily life. Take the stairs instead of the elevator. Make sure the stairs are well lit. Get off the bus 1 stop early if you're in an area safe for walking. Park the car further away from entrances to the store, movie theaters, or your home. Take a short walk around the block with family, friends, or coworkers. In bad weather, walk around the shopping mall. Rake the leaves or wash your car. Visit museums, the zoo, or an aquarium. You and your family can walk for hours and you won't even realize it. Take a walk after dinner instead of watching TV. There are also lifestyle activities, things you do every day. These activities can really add up and increase the number of calories you burn each day. They may also boost your energy and mood by getting your blood and muscles moving. Examples of lifestyle activities include walking to your co-worker's office instead of using the phone or email, planning an outing such as a family bike ride or roller skating, doing a low-impact aerobics or water aerobics. So let's talk about nutritional changes to protect your kidneys. First, stay mindful of your sodium intake. Keep salt and potassium you ingest at moderate levels. Maintain a healthy nutrition. Eat meals with small amounts of cholesterol and saturated fats. Maintain a low protein diet. Too much protein consumption is bad for the kidney. Ask your healthcare provider how much you should eat daily according to your body type. A significant amount of calories is necessary for the kidney, so starving yourself for weight loss is not a great idea. Watermelon, apples, and berries are among the foods that should be at the top of your grocery list. Stay hydrated. Drink about 8 glasses of fluid, preferably water, every day. Not drinking enough water is one of the common habits that can cause damage to your kidneys. And finally, kidney disease is a sobering reality that plagues many thousands of families every single year. Damage to the kidneys cannot be repaired, but it can be lived with if detected early enough, although prevention is the best choice. Taking responsibility over your own health isn't just for yourself. It's for the friends and family you treasure and the impact your life can have on the world when it's lived to the fullest.
Thank you so much, Sorrel Tracy, for those tips on protecting the kidneys. We will now move on and have a presentation from Sorrel Karen Korch. She is a certified mental health nurse. She's board certified in psychiatric mental health nursing. She has spent over 30 years working at the Department of Veterans Affairs and Mental Health. Karen is now retired and spends her time volunteering for many community organizations. And Karen will be covering looking out for one another. So, Karen. You're mute, I believe, Karen.
Okay, there I am. Hi, yeah, I'm Karen, and I'm talking about looking out for one another. So our Kidney Sunday presentation is on Facebook Live this year and not in church, and it's not on Sunday either. So we have to be really creative because we're in COVID times. So as far as looking out for one another, we have to be creative also, because a lot of the literature that the Kidney Sunday and Kidney Sunday packet contains refers to having meetings with people, and we're not really meeting with a lot of people right now, but we can call people, we can contact them through email, whether it be our faith community, our church, or our sorority, fraternity, any our co-workers, any groups of people that we are interact with on a regular basis. And we know that there are people there that may have high blood pressure, diabetes, and some may also have more advanced kidney disease. And so we need to support each other and remind each other the importance of all the things that we talked about here. We need to talk about eating healthy. So if people have cookbooks, they could call their friend and say, you know, if you're having a hard time staying on a diabetic diet or staying on a low sodium diet the way your doctor asked you to, you know, I could loan you this cookbook, or I could show you this website where there's a lot of nice, simple recipes that would really help you stay on your diet. And just the fact of reaching out to a person to ask them about their diet, to ask them if they're remembering to take their meds. I mean, we always, you know, have to stay on each other, because without that, I know for myself personally, I wouldn't do what I needed to do if I didn't have somebody to help me stay motivated, because it's a difficult thing to do, to exercise on a regular basis, to eat healthy, to go to the doctor regularly, and to understand all the tests. You know, there was a lot of numbers that Brenda talked about, and they're hard to remember. So it's okay if you don't remember what the numbers mean, But it's important to advocate for yourself. And when you're at the doctor, to ask the doctor or the nurse, explain this to me. How bad is it? What do I need to do? How serious is this? So that you really understand what your health condition is, and you can be proactive in your own treatment. And understanding your own conditions can help you understand your community's conditions too. So when you form if you have a health committee at your church, or you have a health ministry, being educated about your own health conditions can be helpful to other people. Explain, well, I was told I had high blood pressure and I'm taking a medication every day, and it makes me a little tired, so I don't like that, but I know that I need to do this. And it's very difficult for me to exercise. It's not something that's a natural for me, but I do it. And it's important that, you do it too, because you're a member of my community, and I love you and we love you and we want you to be around and to be healthy. So having that kind of support is the icing on the cake, because without supporting each other, we're not going to be able to achieve our goals. So hopefully, like I said, a lot of the things Tracy talked about, being out in the community with other people. Now that people are getting their COVID vaccines, hopefully, the CDC is saying that people can meet, 2, 3, 4 people together if they've all been vaccinated. So hopefully people have been vaccinated, and they should be able to, go out walking with each other. You can maybe ask your neighbor or your friend from church, if you've both had your vaccines, you can go out and, keep each other motivated, going for walks in the park, walks in the forest preserves, doing cooking together, anything to help promote good health. Another thing you can help your peers with is to, if a person is on medicines and they're having difficulty keeping their medicines straight and remembering to take them correctly, getting them a pill case with days of the week on, and giving that to them. Those are very inexpensive. You can usually buy those for a few cents, and having them organize their pills to make sure that they're taking them in the right manner. It's a very important thing. So there are lots of things that we can do to support each other, and it's really important to support each other, support your friends, your family, your church members, and always be alert for subtle signs that something's not right, with one of your friends or family or loved ones, because it's one of the most important things, I think, is to look after each other and to really have our eyes open, and to stress the importance of working as a team to achieve our health goals.
Thank you so much for that. We are our brother's keeper. So in summary, we have just briefly covered testing and treatment. So from there, you need to remember to know your numbers, make healthy food choices, get daily physical activity, maintain a healthy weight, and manage your blood pressure and diabetes. For risk factors, we want to be sure to know that high blood pressure and diabetes can both lead silently to kidney damage without you being aware of it. And if you have been told that you had a condition of glomerular nephritis, that's the inflammation of the kidneys, and it can be triggered by any type of infection. So that also is a risk factor. And then we have individuals that have the inherited disease of polycystic kidneys, and that is a major cause of kidney failure. And it's just small little cyst-like growth that grow within the kidneys, and it impedes the circulation and damages the kidneys, so they're not able to filter properly. Then we covered protecting the kidneys. So basically, you want to try to avoid the over-counter pain meds. They're called the NSAID. And those are your non-steroidal anti-inflammatory drugs. They consist of your ibuprofen, naproxen, Aleve, Motrin, Advil. We want to avoid smoking. If we're overweight, you need to focus on trying to lose weight and just do it gradually. No crash diets, but just gradually by the steps that have been mentioned, getting out walking, getting exercise in, and try to just do a little bit of exercise each day. And certainly cut down on the salt intake. And then finally, looking out for one another. Help your immediate family, your faith-based family, friends, co-worker, and community to make the kidney connection. So again, I want to thank the panelists for taking time out and giving us those tips on how we can take care of our kidneys. And overall, I'd like to thank you for joining us on behalf of the AACPG and the New Phi chapter of Chi Eta Phi Sorority. And we hope that you take the time to view the video that's located on the National Diabetes and Digestive Kidney Disease YouTube channel. And this information will be in the chat, so you can look for it there. Basically, that site is www.youtube.com/user-NIDDK-gov. There's also a very good, very short video by a Dr. Griffin Rogers, and that's also located on the NIDDK website. You could also get information from the National Institute, I'm sorry, from the National Kidney Foundation, and that website is kidney.org. So again, thank you. Please share, please like, and please post on your social medias. And take care of your kidneys. Know your numbers. Thank you. Have a good night.